Welcome, everybody. My apologies for being a bit delayed getting ready. I was just finishing something else off. Today, I thought I would talk about a little bit about leucovorin and autism. And I must start out by saying I am not an expert in leucovorin, and I don't know a lot about its metabolism. I went to a fantastic talk recently about it, which raised many more questions than it answered, frankly, but it was really, really interesting. And I thought today, rather than sort of go over the science part, which I'm not really an expert on, I thought I would talk a bit about some of the clinical trials that have been done and some of the questions that have been raised by recent interest in leucovorin, uh, and questions that it's raised ethically, I think, for me, and also about treatments and what are acceptable and what aren't. And so I think we'll have a lot of time, hopefully, for discussion and questions. I'd really be interested in other people's perspectives as well on these things. I just want to double check one other thing. Give me 1 second here. Okay. Perfect. Okay. So it's it's like a light bulb thing. Make America healthy again. And I tend to lead to the part of it more than anything else, as we shall see. I have several appearances of conflict of interest, but they will have no implication whatsoever for the talk today. And I had initially wanted to talk a bit about Tylenol, but I've left that out for various reasons. And so we'll just talk about the folate cycle and autism and potential treatments in leucovorin in particular. And if people have questions, by all means, interrupt me as we go. Okay, so the interest in autism and folate and the folate cycle goes back a long way in B vitamins. And so Bernard Rimland, who was the founder of the Autism Research Institute in California, and was one of the first people really to talk about autism as a biological disorder. So I believe he had a child with autism, but at a time when people talked a lot about psychoanalytic interpretations of autism and psychodynamic interpretations of autism, he was pretty strongly advocated for the idea that it was a biological disorder. And he pointed to things like the increase in brain size in people with autism and also the increased rate of seizures and intellectual disabilities, all suggesting against a psychoanalytic cause for autism, which I think really was a shift in terms of thinking about autism and changed a lot of our directions in terms of research, obviously. But he also was a strong proponent of the idea of megavitamins and particularly B vitamins for people with autism. And he claimed significant benefits on the courseness of autism from B6 vitamin B6 in particular, which is involved in the folate cycle. And he said that it would cure some of the social difficulties and things with that. Some research was definitely done, but there were problems with it, and there were a lot of questions raised by it, and it was really equivocal at best whether it made any difference or not. And given that these things are not necessarily cheap always, that the cost of them becomes an issue, as does possible side effects. And so for many years, it just sort of sat on the shelf, really, with sort of as a question more than anything else. And then I think, as far as I can tell, one paper that sort of changed a lot of that was in 2005, was published in the Journal of Neurology. And what this group of authors reported, it was just a case description, but a girl with, as a 6-year-old girl with developmental delay, psychomotor regression, and so she had actually lost skills, had seizures, intellectual disability, and what they called autistic features. And so they actually did a lumbar puncture and found that she had low CSF levels of 5-methyl tetrahydrofolate, which is a biologically active form of folates in the CSF. And they found that in peripheral tissues, that her folate and B12 levels were completely normal, which suggests that it was a specific cerebral folate deficiency. And they found that treating it with folinic acid, which is leucovorin, resulted in corrected the CSF abnormalities and improved the motor skills, but not any of the other skills at all. And so this was, I don't know a lot again about cerebral folate deficiency, but this is sort of what led to that idea that leucovorin might be helpful and that some features of autism may be suggestive of cerebral folate deficiency, and sort of led to an increased interest in this area. So, an article in Science a month or so ago, in late September, sort of discussed this whole issue and talked about how, leucovorin has been tested in a rare genetic condition called cerebral folate deficiency, which is thought to only occur in about 1 in 1 million children. So it's remarkably rare, and it is difficult to assess because peripheral folate levels are completely normal, and so the only way to really assess it is with a lumbar puncture, which we're not going to do with everybody with autism. It's not practical and ethical either. But what they found was that children with cerebral folate, or what they reported in this article in Science, was that children with cerebral folate deficiency would show normal development early on, but then between about 5 months and 2 years, they began to show regress and lost skills, particularly with language delays and lack of motor control. And so they lost language skills. That what is claimed, and I must say for full disclosure, I've never seen it at this rate. It's claimed that up to a third of children with a diagnosis of autism lose skills at some point in life and then regain them later, usually starting around 18 months and regaining them by about 3. I've not seen anywhere near that number personally. What I have seen is parents say their kids will use words and then stop using those words, but they're replaced by others. So there is a loss of words in terms at the word level, I guess, but not in terms of the overall number of words is not what I've seen personally. But certainly there has been this description, and so that's what led to this interest in cerebral folate deficiencies. And so ultimately, then, what became a problem was, though, that obviously we can't do lumbar punctures on everybody with a diagnosis of autism. And so then Richard Fry, who is in Arkansas and has done most of the research, or a lot of it anyway, on leucovorin, developed an assay for cerebral folate receptor autoantibodies in autism. And to see whether or not we could measure these to determine who might have cerebral folate deficiency, because if the receptors aren't working properly, then they would have an effective cerebral folate deficiency, essentially. They might have enough, but it wouldn't work properly. And so what they found, I think they offered it to parents of anybody being assessed for autism in Arkansas. And what they found was a fairly high number of people with, excuse me, with folate receptor autoantibodies. And so they found 70, and then 44 were then included in a clinical trial. And this is the first clinical trial I can find with leucovorin. And their kids were given leucovorin at a dose of 2 milligrams per kilogram. I don't know why that dose was used, to be honest, and because it's much higher than I believe is used normally. So I should go back a bit. So leucovorin is folinic acid, and it's mostly used to correct certain folate abnormalities that occur in people getting chemotherapy. And so that's what it's always been used for. And I believe at a dose significantly lower than 2 milligrams per kilogram. What these authors then did was they had subjects, so after what they call at least 1 month of treatment, so it really varied, and subjects were assessed using the CGI. So the CGI is the Clinical Global Impression Scale. And in some ways, it's the simplest scale because it just asks parents or caregivers or whoever's being asked to rate the child, is their behavior better or not? So there's a 7-point scale. It goes from very much improved to it would be a 1. A 4 is no change, and then a 7 would be very much worse. So it goes from very much improved to very much worse. And the people rating these children were asked on 9 different areas whether their child's behavior was better or worse or the same. And their main outcome was verbal communication, because in studies of kids with cerebral folate deficiencies, they had found that leucovorin helped with that. Having said that, and it just occurred to me, if cerebral folate deficiency occurs in 1 in 1 million children, I don't know how possible it would have been for anybody to do any sort of study of that other than single case studies when they said that the verbal communication was what improved the most. But since it's such a rare thing, it's hard to really address that or assess that. And so then they had this incredibly busy slide. So they looked at, so parents were asked to assess receptive language, expressive language, verbal communication, nonverbal communication, stereotypic behavior, hyperactivity, mood, attention, and aggression. So not really the core symptoms of autism, but problems that people may have. And then, so the dark circles, or the dark diamonds, I guess, sorry, are people who received leucovorin, and the other people were people who were on a waiting list. So they were not an actual comparator, they were just a convenient sample. And if a one is or at the very top of each area, the is much improved, and then at the bottom is much worse. And so we can see that for most of these areas, particularly with verbal communication, with the communication measures, but frankly, all of them, that vast majority of children receiving leucovorin or not fell in the unchanged area. But people who received leucovorin, many more of them were rated as being much better or moderately better with regards to all of these things than children who were taking placebo. Or sorry, not receiving any treatment. They were just a waitlist control group. So, I mean, I think it's an interesting initial study. Essentially, it's an open label treatment that everybody knew what they were getting, and they all received it. But I think that's how science proceeds, right? From observations to clinical trials eventually. But some of the problems with this initial study were it wasn't standardized with regards to time. So the ratings were done at some point after more than 1 month of treatment. So that could be 1 month, it could be 4 months, it could be anything. The treatment was not blinded at all, so everybody knew what people were taking, and people who weren't taking any treatment knew they weren't taking any treatment. And so there really wasn't a comparator group in a standardized kind of way. And also the diagnosis wasn't standardized. So they didn't do cognitive testing as far as I can recall, and they didn't use any other standardized measures. It was clinical impression, which, don't get me wrong, I think that's perfectly fine most of the time. But in terms of making sure we're having a standardized clinical trial, it doesn't really meet what would be considered standards nowadays. But I think it was certainly an interesting first pass at this and a way of saying, okay, maybe we need to do further research in this area. And so then a few years later, Richard Fry again and some colleagues published a study in molecular psychiatry, which is a pretty highly rated journal, comparing folinic acid to placebo in a randomized double-blind placebo-controlled trial. And it was in children with autism and language impairments. And they also measured auto receptor antibodies, folic acid receptor autoantibodies. And so they had 48 subjects, so they had screened a fair number, and the subjects who participated in the study was 48, 23 received leucovorin, I believe, and 25 received placebo. And subjects all met the criteria for autism, but also had language impairment as assessed by a language impairment assessed by a language test. And so it was double blinded, so neither the parents nor the patient nor the physicians or the people prescribing it knew what people were taking. The groups were quite similar on demographic variables. So with regards to their age, they were very similar. In terms of their socioeconomic status, they were similar. They were predominantly males, as we would expect. And people received 12 weeks of treatment, either of placebo or leucovorin. The main outcome measure was a change in a language score on an ability appropriate language scale, and I'll come back to that in 1 second. And what they found was that there were certainly improvements on many scales, including a language scale. However, Joan, I hate to pick on you, but I'm going to anyway. So first of all, they used a variety of different, my apologies, they used a variety of different scales because they have people of different ages and different abilities. But one question, Joan, I would have for you is how comparable are these things going to be across groups, do you think?
Well, in theory, standard scores should be compared across different protocols, but I think we know that test-to-test reliability and validity isn't always 100%, so there'd be room for error.
And also, I don't know by ability appropriate language scale. So I guess this, like the preschool language scale, how comparable is that to the self-P?
I'd have to look it up. I don't know. I mean, I think they're both regarded as valid protocols, so I would think it would be fairly high, but I don't know the numbers.
I think one of the other criticisms of several of these studies is that the measures that they used were not necessarily, I don't know if they used standard scores, Joan, or if they used the raw scores and then looked at changes in them, which I think age and things like that might have some impact as well.
I wouldn't feel very confident if they were using raw scores.
Except though, but then wouldn't that give you, so why was that?
Well, I just think that the math of it, right? I don't know what the significance of difference is for a change in raw scores for one test to another test.
Oh, I see what you're saying. Okay, yeah. So are the scales, the numbers actually equivalent to each other?
Yeah.
Uh, yeah, and I think that was one of the criticisms in this article in Nature from Jerome Scahill, who is in North Carolina, I believe, was asked about it. But what they found was that people taking leucovorin showed improvements on many scales, including language ability. But, um, and that included their verbal communication in particular. However, again, there were a lot of difficulties here. So the diagnoses were not standardized. About 50% in each group had the ADOS done, and I think 70% had the autism diagnostic interview done. But a number of other people, it was clinic uh, sort of impression, which again, I think is fine, but it's not standardized in any way. It was a fairly short study, so it was only 12 weeks. And I'm not sure what it means to have an improvement in language ability because I don't know if 12 weeks is enough to see that and how quickly it occurred. Sample size was also relatively small, although for autism isn't out of the ordinary, but certainly is smaller than you'd expect to see for all kinds of other things. The other thing is they looked at the Vineland, the language test. They looked at the something called, I think, the ORS, which is the Ohio Autism Rating Scale. They used the aberrant behavior checklist. So they did all kinds of different measures and didn't correct it all for the fact they did multiple statistical tests. So in statistics, we use zero point zero 0.05 as sort of the measure of clinical significance, meaning that one out of the likelihood of finding that difference is by chance alone, it's only one in five times, or sorry, one in 20 times. But if you're doing 20 or 30 different statistical tests, then by definition, some of them are going to be positive. You're going to find just because of the number of tests. So it wasn't really corrected the way it should be. The other thing is, and this becomes an issue in all kinds of areas in terms of doing double-blind studies, is that if a child is starting to show improvements in their language output, and and their parents are aware of that, as we're teachers, is it really blind? If we really believe that's the outcome and that's because of medicine, is it really blinded at that point, or is it actually is the child's improvement unblinding it? Meaning parents and people are more likely to see improvement than they might otherwise at some level. And this is a huge issue across lots and lots of studies. I think in autism, what we try to do now is have different people assess side effects and the benefits and improvements. So that way, at least we're not using side effects as a measure of blind of whether a person's taking medicine or not. So, and the other question is for Joan was in terms of the outcome measures. And although they found improvements in a lot of things, it was a lot of things that I wouldn't expect to see improvement in, frankly. And I also wonder again about just the likelihood of finding improvements in language ability in the space of 12 weeks. I also wonder about the likelihood of medicine uh, being able to actually affect our language abilities and how that would help. Biologically, I don't understand the mechanism at all. Okay, so several other placebo-controlled trials have been done largely by Richard Fry again, and this has led to similar results each time. So he has replicated himself several times with similar methodologies and similar questions with each one and fairly small trials. And I'm not even sure how this got in the news. Early in 2025, there was a piece on CBS News, and I myself, and I know I've spoken with pediatricians, other psychiatrists, started to receive a lot more questions about leucovorin from families and whether it was appropriate and what our thoughts are on it. And then in September 2025, somewhat unexpectedly, I think, RFK Jr. At his announcement about Tylenol being one of the causes of autism, announced that it was, along with the FDA, it said that it was a fast-track approval for leucovorin for ASD. And in fact, Marty Makary, I think is how it's pronounced, last name is pronounced, is the FDA commissioner or the director. He actually said, this is the first treatment for autism that's been approved and leads to the first sort of pathway. It's not strictly correct because there are other medications for autism, although they're not to treat autism, they're to treat behavior problems associated with autism. But the other thing that is ignored in this statement is that the approval from the FDA actually is for leucovorin for cerebral folate deficiency. And it very specifically says that it's not for autism itself. I think they say that children with autism may have symptoms similar to cerebral folate deficiency, but don't really talk a lot, but don't mention Trump and his people and Makary and RFK Jr. And Mehmet Oz didn't really talk about the fact, although they said it was for autism, it isn't really. And so this has led to a lot of questions. And I personally, I'd say at least once or twice a week in the last month and a half, 2 months, have had a number of questions from parents about this. And and it's led to a lot of questions on my part. So I was at a dinner with several pediatricians in late September, I think, and it was a talk by a pharmacologist, and we sort of reviewed the physiology of folate and folinic acid, and also the clinical trials. And ultimately, what it comes down to is there is some suggestive evidence at best, but certainly not the kind of thing that we would use as good evidence. And it's somewhat surprising the FDA has actually said they're going to fast track approval for it based on these small studies. But also, what came up a fair bit, and this is what I'm also really interested in hearing other people's opinions about, is what we do with this information, because we parents are asking about it. And on the one hand, part of me wants to say that if we really believe in evidence-based medicine, that in my mind, this doesn't constitute evidence at all, that it's suggestive, but I don't think it's enough evidence for me to recommend treatment with it. And at the same time, it is pretty benign. I believe the only issue is if people have a strong family history of leukemia or something like that. And it is also not inexpensive, but if people have insurance, it's going to be covered by that. And for most kids, since they would either have ODB coverage under OHIP plus, or they would have um, private insurance, it's going to be covered. But also, I don't think personally that just saying something because something doesn't have a lot of side effects, I don't think that's a reason to recommend it to people. But the other side of me, and I go around and around in my head arguing about this, is that I'm fairly confident if I say no, I can't prescribe it, or I don't know enough about it, or I don't feel it's appropriate, that the families will be able to go somewhere else and somebody else will prescribe it for them. And so is it better than to have it done in a more controlled manner where we can focus on things and do it carefully? So actually, at this point, I don't have a lot more to say about leucovorin because I don't know a lot about the physiology, but I'm really interested in hearing what other people have to think at this point and what people are going to do when families start asking questions about these kinds of things. So, Joan, if I may just pick on you again, I mean, and Joan and I have not rehearsed this or discussed this, so I'm asking her completely open-mindedly, but based upon what you've seen, which isn't much, but does 12 weeks biologically make any sense to you?
Seems pretty fast. It doesn't speak to any intensity of intervention either, right? Like this is just medicine and it's making a difference. So I wouldn't expect therapy to make a difference in 12 weeks. Weeks, I don't know what medicine would do.
Well, and I guess I'd have to look more closely, and I should have, at how much improvement, because I think we know there's cases in lots of studies where you might see a statistical difference, but a clinically irrelevant difference in measures. And I think that I don't know whether the difference they found were meaningful, and because they used multiple different scales, it might be hard to assess that as well. But that was the concern I had, was that it seems like a very short period of time to see an improvement in language testing, in language results. Jackie, what else have I left out that we were told?
What else have you left out? I guess a question with before that would be for Joan, even how reliable are those measures for measuring change over 2 time points? Because there's some effect around like the actual testing, and I don't know if the learned effect is something that we worry about in language testing. Any comment on that when we're using it as change over time?
So I don't think there's a huge concern for test retest reliability, interfering with a language test per se. But what's interesting is different tests will look at different things. So some tests are more sort of vocabulary focused, some tests are more syntax focused. And I'm not really sure, again, if, as Rob's saying, there's a variety of different protocols being used. Well, theoretically, standard scores can be compared against one another. I'm not sure that the language tests are measuring the same components of language. I'd be more concerned about that.
Good point.
But also, Joan, I mean, so for example, one of the measures that the authors used was a Vineland Adaptive Behavior Scale, and I'm fairly confident that the Vineland asks parents or people filling out to rate their child over the previous 6 months. And if that's the case, then assessing something over 3 months, is that really meaningful in any kind of way? And I don't know, is there a time frame? Well, I guess with any language test, the time frame is just when you do it.
But the Vineland's an adaptive
Yep.
measure. It's not a measure of pure skills. So I'm not even sure that I didn't realize that that was one of the protocols that was included as their assessment battery. I'd be
But I
concerned that
think,
they're using adaptive and sort of core skill assessment
oh, they used
protocols.
a lot of, and I think that I think that I think the Vineland is used a fair bit in autism research now, in part because we just don't have any great measures. And so the question really has come up more and more is what are our outcome measures? What should we be using as outcome measures? And uh, and the Vineland is one that's widely used because it has sort of a social domain thing to it, but it is also over a relatively short period of time.
Well,
Uh,
and I think the Vineland's really open to parents being subjective. And I know even our clinicians in psychology that use the Vineland typically do an interview rather than the form because how parents interpret the questions can change the results pretty wildly. So,
oh yeah, oh for sure.
yeah.
And that's so what we've done in a couple of trials now is make sure that the same parent at least is the person filling it out each time or doing the interview. Because
Mhm.
otherwise, if you get two parents doing it, you're going to get completely different results.
But you never want a standardized test that ends with the punchline of you can get completely different results. I think that sort of flies in the face of a standardized test.
Yep. Yeah, absolutely correct. I'm just looking here. I just want to see one thing here. So statistical analysis of primary outcome measure, and all they really do in this table is they just look at what they just look at statistical analysis of primary outcome measure of verbal communication responder analysis. So that's not even the whole group. It's just the responder specifically. And here, and with verbal communication. Um, So, and because they used different measures, they had to sort of, I think, try to scale the scores down, which means you're going to get all kinds of differences, I think, that may not be real.
Yeah, I think there's a little more fluffiness to it than I first interpreted your question. I thought you were asking what's the self preschool versus the PLS? Then I think you can compare measures. I think what's the Vineland versus, a standardized language test?
Oh,
That's
no,
a very
that's different.
different
No,
question.
that's different for sure. But I think the measures that they used, if I can, were um, uh, the secondary outcome measures. So there was the language stuff, but then also they looked at the Vineland Adaptive Behavior Scale, Aberrant Behavior Checklist, where they used raw scores, and then the Ohio Autism Clinical Impression Scale, the Autism Symptom Questionnaire, the Social Responsiveness Scale, Autism Impact Measure, Behavioral Assessment for System for Children, so the BASC. So they used a whole bunch of different things. Their main outcome measure was language, and they don't even, but that was I know there were several different measures they used depending upon a person's age and ability and things like that. So I'm just not sure how comparable they are.
I mean, really, I don't know at that point in time whether it's much different than just asking parents, do you think their language is better?
Yep. Okay, so Jackie, did you still have your hand is still raised?
Yeah, I was gonna, you asked if there was other things we talked about in our journal club
Yep.
review. So we also talked about the lack of guidance around length of treatment if we are going to consider this in terms of being informed by the data and have a frank conversation with families, is that everything that's published is very short term. So how long to treat for? You alluded to what are the possible downside? Well, on bench research, the risk, some evidence that it increases proliferation in leukemic cells. So maybe pause in a fifth child with a history or strong family history of leukemia and avoid in that use. But really around like how long to treat for would be a individualized decision. And we talked about things to consider, because families are asking about this. What are possible downsides clinically? Masking a B12 deficiency or megaloblastic anemia. So if you've got a kiddo with a severely restrictive diet, think about blood work. But that's also going to be pretty rare. I don't know about you, but we're also seeing from some of the community naturopaths around directing families to us for B12 injections. So I know that's different, but there's a kind of a confounding of these factors seems to be coming at play and coming to a surface right now.
I have not yet had that. I'm
Mm-hmm.
looking forward to it. All right, so we had two comments from psychologists. So, Dr. Adrian Perry at York, welcome, by the way, Adrian. Adrian, do you feel comfortable with sort of talking aloud about your comment about the pre-post comparisons over a short time frame?
Sure.
Okay.
Just that was just the point that
Yep.
if they're even if they're measuring the same test at one time and then at the next time, um, it that is prone if it's a skills-based kind of test, that's prone to practice effects. That's all. There was just one extra little point along with all the other points you made about the kind of crummy methodology.
But I think without wanting to be too critical of the author, I think we're stuck with what we have, right? That we don't have any good outcome measures at all. And I think the Vineland is one that's being used more and more, but the issue becomes that I don't know how much variance there is in each measurement over time. And we know that with a lot of scales in ADHD, and I think Catherine Lord has shown the same thing, that if you give parents certain, I think it's the ABC, the aberrant behavior checklist, and then and their children have autism, if you ask them to fill it out and then get them to do it a couple of weeks later, scores often go down, despite the fact that nothing has changed in the intervening time. But I suppose that if it's a placebo-controlled trial, you would expect that to be equally distributed between both groups. So the fact, Adrian, that there was a comparison group, does that change your comment at all?
Well, if they had, it depends, I guess, on how many of the kids in each of the groups had which measures and all that. I'm not familiar with the study, so I can't
And
really
I,
say.
and I couldn't find that number at all.
Yeah.
I looked hard. All right, thank you, Adrian. By the way, how are you?
All right, thanks.
Good. I'm
Nice,
glad to hear that.
nice to be here.
Thank you for joining us, Rhonda Peterson from CBI. Do you feel comfortable, Rhonda, talking aloud?
Um, sure, I
Okay.
guess.
I don't want to put people on the spot, but I guess I just did.
That's okay. I had to figure out how to unmute myself. Um, yeah, so did they use that measure of looking at whether it is clinically relevant or no?
Hang on, I can tell you in 1 second. I don't believe so. I think that
Okay.
what I'm just looking here at it. The uh here. So I'm just looking at it here, and under I have so many open windows here. No, so actually, well, if we go, how is a minimum significant difference determined?
I don't know that. I was at a conference with Dr. Ashley Miles, who works in epilepsy in neuropsychology. And she did a whole presentation about calculating this, not for the Vineland, but for many others. And it's really quite complicated to do. It's possible, but
But if
I don't know specifically.
but if it's a minute, but if it's a minimal clinical difference, and I don't know enough about this either, but they do they but they so actually it's a really interesting point because what they found, for example, on the Vineland, on the communication part of it, so people taking folinic acid, their score average score went from 66 to 68. Whereas people taking placebo, their score went from 65.9 to 66.0. But they also say the minimal clinically important difference is 3.8. And the difference we see in the folinic acid group in communication was 2.1. So does
Oh,
that then suggest that that difference is not meaningful?
that's what I would expect.
And in fact, that there was the p-value there was that was zero point 0.8, so it was incredibly high. And they did that for everything. But as I say, they also did a lot of different tests statistically and didn't really correct for them. Uh, all right, because the other thing I would wonder about, and Jackie and I had talked about this with a few other people, but what are people's thoughts then, especially among clinicians, I guess, about prescribing folinic leucovorin? Because parents are going to come and ask about it for sure, if they're not already. And I wonder how people are planning on approaching that. All right, don't all rush at once. Because, again, I'm waiting for somebody to say something. It has really been an issue for me because on the one hand, I want to help parents out as much as possible, but on the other hand, if people really are pushing it, is it acceptable to prescribe it or not? Rohit Nagar, feel free to go ahead. Just unmute yourself.
Yeah, can you hear me now?
Yep, perfect. Hi, Rohit. How are you?
Hi, hi. No, I'm very well. Thank you. Very interesting discussion. So I was absolutely going to ask this question if you wouldn't have included this in here. So several questions of this leukovariant by several families for children with autism, to the extent that they were last few, they haven't even been asking for a prescription. They said that we have people who can send this over just as a doctor, as our pediatrician, tell us if this is okay for us to go ahead, right? So you're right. Like, I mean, if we don't do it, someone else will do it and they will start it. So if, I mean, I do get the discussion about risk of leukemia. If there's a family history or personal history of it, for sure, we could avoid it. If there is no significant reported harm for a 12-week duration, like that's what the study said, right?
Yep.
So, I mean, if we could have like a consensus, not even like guidelines on if it is safe to do so, we do a 12-week burst. If things are significantly different, then we consider renewing or continuing or letting it go. What do we think?
But I'm just trying to think of what the most ridiculous example would be. So if parents came in and they were asking you for, they heard somewhere that methotrexate helped autism. Well, I guess methotrexate has a downside, doesn't it? I'm trying to think of something else that would have no side effects. But I think that because the idea of evidence-based medicine is that we've improved because we want evidence that things work, not just that the lack of harm.
Mhm.
Hmm.
But at the same time, I think we want to be, I guess, aware of what people are asking for, and is it better to do it in a controlled fashion so at least we know what's going on? So,
Exactly. I mean,
so Rohit, what have you been doing then?
so, I mean, right now, so like I wasn't aware of the study. So, of course, I mean, I'm not going to start doing LP on these patients to for measure the cerebral folate level. But I did like the RBC folate, a blood work, and all of them come back normal. And I've been telling them like right now, unfortunately, I cannot prescribe it because there is no deficiency, and I don't want to prescribe something which could do any harm to your child. So I have been saying no. But then last couple have asked, okay, no, we do have people in the US who will prescribe this, or we can order this for our child. What is your opinion? Is it okay for our child to get this? Is what they're getting us with, right?
So with my understanding from what was discussed at this meeting a month or so ago, Rohit, was that in people with cerebral folate deficiency, their peripheral folate indices are perfectly normal. And the only way, unfortunately, to measure this cerebral one is so there's that discrepancy, and the only way to measure it is with an LP, which, as you said, we're not going to do. And I think that I'm not sure about the validity of the autoreceptor, the receptor autoantibodies. And I believe that one of the people who's been the first author on many papers is actually the person who also has patented the auto antibody methodology, which, again, I don't want to impugn anybody's reputation, but it's a bit curious, I suppose.
Yeah, I mean, families are desperate, right? As we know, most of them
Yep.
are going to willing to try anything and everything, and they have tried a lot of like rare minerals and these chelations and so on and so forth. They've at least read about it and asked, and we keep on saying that there is no evidence that this will work, and there is truly none. But if there is some bit of hope, right, for them, that is what they would like to know. And as pediatricians as well, right? If there is no significant risk of harm, is a short burst thing, and we could probably do our own little study here if we kind of have a few, if we are able to decide on something, right?
But as you're saying that, Rohit, I was also just thinking to myself, given that we know the variety of autism and how it's diagnosed, I wonder if, and I'd have to think about it for myself, the parents who are asking though, are they the parents of the more severely disabled kids also?
Yes, the ones I have had the last six months is when this question has come up,
Yep.
right? The ones that have asked are like severely non-verbal, non-communicative, hyperactive, aggressive boys, right? And they
Yep.
have been asking this question. So
So more in keeping with what we think of as autism.
exactly, yes.
Which is an interesting thing. Thank you, Rohit. That's really
Yeah.
good insight. Dr. Goldberg, if you would like to go ahead and unmute yourself, I will unmute you also.
Okay, can you hear me now?
Indeed.
Okay, I just want to comment a little bit on the political, psychological reasons for this September push for leucovorin. Robert Kennedy's aunt was Rosemary Kennedy. She was the daughter of Robert Kennedy, who was assassinated. Uh, Robert Kennedy Jr. is on the outs with his family. He, of course, was the fellow who bought the English scientists' business about the vaccines
Yep.
causing autism. And he said by September, he's going to be introducing the research that will really causing autism. So he's pushing this for really to compensate for the from his family and also from the bad press that he got vaccines.
But Ben, do you think he cares about the bad press?
Beg pardon?
Do you think he cares about the bad press?
No, but yes, I think he does. I think he's also trying to get back with his family as well.
Right.
Okay, because his family was, of course, very concerned, and we have a sort of a London connection with the Special Olympics was founded by his aunt, Kennedy.
Yep.
So he's very involved with the developmental disability concept, and so he has a push. Sometimes the push is inappropriate.
Well, he is a very colorful person, that's for sure. He's got a long and checkered history, I suppose. I think he started out as a civil rights lawyer, actually. But was also heard, well, he was interviewed last year or something. He said that there is no such thing as a safe and effective vaccine. And when somebody on CNN recently called him on that and asked him, he said that he hadn't actually said that. And so they, of course, pulled up the tape right away, and then he went on about something else. But it is an interesting time, but it's also, I don't know why he would venture into the whole issue of causes. And that's one thing with the acetaminophen, but also then talk about treatment and something that I don't even know what he would have read about it. Dr. Mitchell. Oh, sorry, Ben, do you have something else to say?
He's confusing causation with correlation.
Yep. But I think he's walked that back now a fair bit, actually. But Dr. Mitchell, welcome. Would you like to, I will ask you to unmute yourself.
Yeah, so, I think these are difficult questions when families are asking for unproven treatment. So I think, a couple things I think about. So one is to just talk to them a little bit about what we do and don't know about leucovorin, which is not very much. And then I think the second piece is to go over with the families, what they're doing that we do have evidence for, because sometimes, in a variety of conditions, parents and families are jumping to the newest unproven possible treatment, and they've jumped over things that we know work quite well. So, if the child has autism and highly hyperactive impulsive behavior, have they tried a stimulant medication? Have they tried behavioral strategies for that? Have they had some extra speech therapy? Because there's a cost to leucovorin, and sometimes the money is, I think, better spent elsewhere. So sometimes that helps families, circle back to what we know works, and they leave the experimental treatments. I think where it is worth trying are in some of the kids where they have actually done all of the evidence-based treatment, and they are left with, a child who's very irritable, not progressing in language, and so on. And then I think it's reasonable to kind of step out and talk about the risks and benefits and try it. And then at that point, I also talk to the families about their goal and how we're going to measure it. And so that we're not going on and on with a treatment that isn't achieving a goal that it might help or that they would like to address. So I guess that's my approach. Each family is a little bit different. And as Dr. Nagar said some families are just going to go and get what they want somewhere else. So I think we just try to navigate it as best we can.
But yeah, I think the point you and Rohit made also, Claire, is really good. The parents will do whatever they can. And if somebody says this is going to cure your child, I think that's pretty compelling potentially for people. I saw a boy recently who his mother had taken him and his brother to a country in Europe for stem cell treatment, and I would assume it probably cost them $30,000 is my guess. And personally, I would say that I think based on the evidence that I think they would have been better off putting that into a disability savings plan. But I think that if parents think that it's going to solve their kids' problems, I think people will do whatever they can. We know that. And that's where it becomes really, really difficult. So Jackie Ogilvy asked, and Jason, I don't know if there is a way, but among those in attendance is if any community physicians would like to talk, or anybody else, talk about if you've had any pressure from families to prescribe it, and how many people actually have, because it's interesting what Rohit Nagar was saying about how families are now saying they can get it from some other source. I'm not sure who that is, but they're obviously able to go out and get it. And so, how are other people dealing with the pressure to prescribe it? And so one question that Joan had was, is there an age range of subjects in the leucovorin study? So there was, I think in the one study I talked mostly about, average age was about 7. But I think that there is some suggestion, perhaps by Richard Frye himself, that if people are going to use leucovorin, it should be on really, really young kids, where there might be more of a potential for language-based improvements. I guess what I'm stuck on still, though, is the whole idea of medication being able to improve language. And I think that my own sense in autism, it's not necessarily language that's the problem, it's communication that's the problem. Because I think we see lots of people who have echolalia, they can speak just fine, but don't communicate well. And I don't know how medicine is going to teach somebody the purpose of communication. I don't know how it would affect actually learning how to talk either, but just the idea of teaching people the purpose of communication is something that completely eludes me. Oh, there we go. So Jason Wittes, the fantastic Jason, has just put up a poll. I don't know if everybody else can see it. So let's see. Right now, so 7. Sorry. I don't even know how to interpret that. So 5 out of 9 people have said that yes, they felt pressure to prescribe leucovorin. And I guess then the question would be, as a follow-up, if that's okay, Jason, is did people actually prescribe it in that situation? And we'll say there's no judgment here because I think it's something we're all struggling with. Because what I've been doing, and it's not by any means courageous on my part, and I certainly wouldn't hold it as we go, is telling parents that I had to look further into it and I wanted to find out more and that they should ask me at the next appointment. However, I don't know what I'm going to say at the next appointment either. So that question, well, I just sort of, I'm pushing the can down the road, unfortunately. So far, as you can see, people who have been asked about this. So one person has said they had prescribed leucovorin to a family, whereas 8 of 9 people said they hadn't. And Jackie, I think you said that you had considered it in a couple of people. Was there anything that led you to prescribe it or not to prescribe it in those people?
Yeah, so I did the same tactic you did, push the can down the road. So ask me at the next visit. But no, I think for the volume that I've been asked about it, a fair number of families have been open to hearing about it. It seems to be a little bit like the vaccine story where there's like a group that are curious and open to hearing the information, and like Claire's discussion around, okay, let's come up with a plan to do X, Y, and Z first. The 2 families that are remaining are kind of staunch, very ingrained in this approach and have explored other alternative therapies. And I am meeting back with them, and I'm taking the approach, a bit of a thinking harm reduction approach, really, because I am worried about disengaging from them and them seeking other treatments. So their kiddos are quite affected, and so I'm not sure that studies generalize to their children, but I think with some guidance and setting some goals, I would consider it because of that, keeping the door open. And then, like you said, it's not so much about just doing no harm. I'm actually thinking on the if the not this, what other avenues are we going down? And I've certainly seen seems like a renewed energy in seeking some of these alternative therapies.
Yeah, you mentioned detox in your host here,
For
but
sure.
but Jackie, if I can be devil's advocate and argumentative, which I generally am not, but the no, but is it possible though that by prescribing it, we are then giving it the seal of approval?
Yep.
And but by
Well,
doing
by nature, I mean, you're in a way, you're saying here, I endorse it enough that I'm going to prescribe it, but it also is like that you're doing it with clear goal setting and follow-up plan too, right? Like you can still choose to not keep prescribing it.
yep. But because then the other thing is though, but if I guess is it with all these sort of alternative treatments, are some of them gateway drugs in a sense that once you do one, you might as well do others?
Not no no I think that's a little bit of a stretch because I'm even thinking things like magnesium.
Yep.
We talk about using magnesium for sleep, and I know Aaron St. Laurent will often say like, how's that working? And maybe we talk about cofactors and crossing the blood-brain barrier. There is some if we're thinking about restless leg syndrome, but like if the evidence there is not voluminous either. And
Okay.
we often recommend that. So I think there's other things we do accept slightly lower robust evidence, but because the downside is pretty nil, we say go ahead and try it.
Yeah, it'd be interesting to see if
But you don't have to prescribe magnesium, like families then
no.
make a choice to do it, right? They can go up to Healthy Planet and
Yep.
look at the wall of supplements.
But I wonder too though if leucovorin actually if people had to pay out of their pocket for it, what that would do?
Well, a
Because
number of people, we've talked about this redirecting the cost of leucovorin to SLP, and I would put out there that if leucovorin's covered, like this is where there's some systems problems that we're not talking about just redirecting funds. Like, yes, if families are paying out of pocket, fair, but that's not often or that I'm talking about at least. And these are families that could get it covered. The SLP coverage for them is very minimal. It's not comparable. So there's not an equal redirect, I guess.
no, but leucovorin is also not inexpensive. I
Nope.
think for everybody in Ontario it's going to be covered, but one 5 milligram tablet, the ODV pays $1.84 roughly for that. But if people are taking 10 of those a day to get up to 50 milligrams, that is $18.40 a day,
Yeah.
which and again, I consider myself pretty left-leaning politically, but we're all paying for that ultimately.
That's a
It's
good point. And I think we looked at in Journal Club, there was a French study that also did it with 10 milligrams. So I
Yep.
guess there's the thought of, do you have to go all the way up to 50 and do you set a different starting point? I guess the outside thing to really consider, because you raise a good point about resource allocation is, could we drive shortages of leucovorin for cancer patients?
Right. Well, that's a great question because I think that's what happened with the GLP-1 inhibitors, did it not, early on?
I don't know the stats on that, but I would believe you
I think
said
when
yes.
Ozempic first came out, I think so many people were using it for weight loss that it wasn't actually available for people
Right,
with
for diabetic.
diabetes. Yeah.
Yeah. Yeah. So are we looking at that kind of a phenomenon? No, I don't think it'll be quite at the same pace, but it's something to consider.
Uh, okay. Other thoughts or comments? And I think this is really fascinating on my part just to hear other people and how people are approaching this because, and maybe I give off some vibes about not believing in stuff, but most parents who've asked me about it, they've had sort of a sheepish grin on their face, as though they've almost been embarrassed about it. And I don't know if that's because of me or it's because that they're talking about something that Robert F. Kennedy Jr. said, or if there was some other reason. But when people have approached you, Jackie or Rohit or Claire, have people seemed, yeah, at all sheepish or embarrassed about it?
I would say mostly no. I've got mixed. I've got families who come full on in. That's the topic of conversation they want to talk about, and they know where they're getting the information. They've looked into it. The other one, I have to pull it out and actually probe and ask about that interest, and then it comes out that they've been reading about it online and looking into it more, almost like the door handle conversation.
Yep. But so Jackie, when you said it would be done in a control way and we'd have outcome measures, so what have you been suggesting to parents after 12 weeks? What are you going to look at?
I didn't say we'd have outcome measures, but I would
Okay.
say so. The idea was that, so I spoke to one of our behavior consultants on how she's done it. And so she had the idea of having families, if we set a goal, picking a time a day for behaviors that you're particularly trying to target, and use videos. So use a video diary, have families try to video certain routines or something and see how they go and compare those week to week over the 3-month trial.
Which makes perfect sense. That's good. Yeah, 'cause I think, but when you say we can always deprescribe, I guess one question of mine is, can we actually do that easily?
For sure. Always a little harder.
Yep. Tuche, you had your hand raised, and I think I unmuted you if you wanted to make a comment.
Yes, can you hear me?
Perfectly well.
Awesome. Yeah, sorry, I never obviously prescribe and never will. And this is just me coming from a point of view of you've addressed this a little bit already, just in terms of therapeutic effect. So sometimes we find we get pressure not to prescribe, but to do genetic testing, for example, when it is not entirely indicated or not evidence-based in one situation or another. And sometimes, and this is just again, obviously family dependent and very much context dependent, but sometimes we find ourselves actually ordering the genetic test almost as a therapeutic option to the family, not necessarily to the benefit of the child, but like almost therapeutic for the family. And I know this is very different than prescribing a medication where it goes into the system. And of course, you made excellent points about like the cost to the system, to the family, and all these things. But like Jackie said before, you always have the option of not prescribing it again, especially when you lay it out so well that you did in terms of discussing the risks and benefits, you know what you're getting into, and you have outcome measures almost as a, okay, now we've tried this as well, like just to not break the report with the family or things like that. Again, kind of also supporting some of the things that were brought up by Rohit about, families being desperate and just wanting to try this. Yeah, just
But
those
I
points.
think Tuche, those are great points because I think this is where clinical guidelines are often really problematic because they are in idealized situations and they don't necessarily take into account the family or patient's perspective. But in those cases where you do it as a therapeutic measure, how often do you actually find something?
Yeah, not often. Well, actually, not at all. But then the family is grateful, right? And the family feels better, and they stop asking.
I think
And they almost feel like, okay, now at least I've ruled it out.
I think if people stop asking if that's a way to do it, I think that's hugely important because it also answers that question for them and hopefully puts it to bed. Uh, if they kept asking, I think that'd be a different question altogether.
Yeah, I do. So I just want to share, I have prescribed it once and I haven't seen the family back. So I don't know whether they gave it to the child or not. But I have been really thinking about this family because they are really grieving that their child has a diagnosis of autism. And I am really sort of questioning in myself, whether prescribing the leucovorin as, at their request and after everything I said earlier is really helping the process or not. Because I think, in developmental disabilities with children, we always have to give families hope. But at the same time, we have to be realistic. And so as we ponder all of these things, I think we don't want to give false hope to people or to be, encouraging that false hope or taking part in that and really try to be objective. And I think it's each family at a time to make sure that we're really helping them and not feeding into something that is actually not helping the family and the child. I don't know the answer yet.
No, but that's a really interesting question also, Claire, because I was at a talk years ago, and I remember, and I think it was actually Paul Davenport, who was the president of the university, and I was talking with him, and he actually said, is false hope worse than no hope? And I don't know the answer to that question.
Right. There's a whole study on learned hopelessness, though, right? So maybe give up if you have all these false hopes and, maybe better to have realistic. I mean, I don't know the answer,
Yeah.
but
Good stuff. Rohit, did you have something else you wanted to say?
I was just going to add here a quick little thing. Dr. Mitchell's point is very valid about the false hope things, right? But the patients I was talking about are older boys, 5 or 6 years plus, who have been through those treatments. They have had the ABAs, they have had stimulant trials, and most of them do not you find them helpful. They do worse on it. So I'm slipping stimulants and they're unable to stay on any, and they have no benefits. We've been trying antipsychotics. So medication trials have been done, SLP is involved, and this continue to be suffering from behavior issues, right? And that's when the families come to us asking for these kind of interventions. So slightly different, like patient population of older kids who've been through other therapies, right, and who have failed any, and then they're asking for this option. So I was just wondering if there is something, again, like maybe we could go over the risk benefits, right, not give them false hope that this is what we are getting into, but is a 12-week trial thing based on this study that you presented totally unreasonable?
I don't know. That's a good question. Right? What do you think?
I think not. I think if we explained it to the parents that see, this is, we have limited data. We still do not know if this is a really proven or going to be a gold standard therapy by any means, right? But if this is what we do for 12 weeks, and if we have any side effects before even the 12-week duration, then we just stop and then we review our options.
Well, and and Tuche just put something in the Q&A that I think I would have to sort of do some soul searching about, because he said, that the are we somehow dismissing, at least recently, the whole idea of leucovorin because of the people who are endorsing it? So Robert Kennedy, who's been as well, sorry, Touche said had been famously wrong about other things, but and I think it's somebody who's pretty disreputable now. But am I also just poo-pooing this because of it's Robert F. Kennedy? Whereas if it was somebody else, it was the head of the American Academy of for the Advancement of Science, people who put out Science magazine, would I be different? And I don't know, Touche. I think that's a really interesting question as well. Okay, well, thank you, everybody. This was a really interesting talk. It has been really helpful to me personally, just to sort of put people's thoughts together. I hope it was interesting for everybody else. In the chat, Jason has put a comment about that about sort of filling out the evaluation, please, and in order to get clinical continuing education credits. And then, so a couple other things. So our annual continuing professional development day is going to be on April 16th. If people want to save that date at the Ivy Spencer place up on Windermere with lunch. And we'll have 3 talks in the afternoon. And then if we are still looking for a speaker for February, so if anybody has a case discussion they would like to do or a presentation, please let myself or Jason know. Next month on December the 10th, Dr. Chitra Prasad and myself are going to present a case of a young lady with a fairly rare enzyme deficiency and a developmental disability. So that's on December 10th, I believe, at 4 p.m. So we're looking for everybody there. Look forward to seeing everybody. And if people have any other thoughts about presentations, please let us know. But thank you, everybody, for coming today. It's been really illuminating for me, and I hope it was for everybody else too. All right, take care.
Thanks a lot.
Okay, thanks, Roy. Bye.